Welcome back to TV5 News at 9. It is time now for Medical Moments with Covenant Healthcare. Joining us this morning is physical therapist Jason Henry. Thank you so much for being here. How are you this morning, Jason?
Good. How are you doing?
I'm doing well. Great to have you here. We're so delighted that you're here. First, to get started, Jason, tell us a little bit about your role and the work that you do with Mary Free Bed at Covenant.
Well, as you said, I'm a physical therapist. I work mainly in the inpatient or acute care side. Basically, I see patients while they're in the hospital. A lot of our focus is on getting those patients moving to help them recover, which sometimes it includes making them as safe as possible, including working on their dizziness or any balance issues they may have.
Okay, well, let's jump right into the topic today, Jason. We are talking about vertigo. Now, some folks might have heard of it, but can you tell us a little bit about what it is and some of the symptoms of vertigo?
Best way to describe it would be a sensation that either your surroundings are spinning or that you yourself is spinning. Some people can fall due to that dizziness. One thing it is not is lightheadedness, like the feeling faint sensation. That is something different.
Oh, okay. So now it's interesting to know that there are different types and causes of vertigo. Some are treatable with physical therapy. So how can your team help someone who may be dealing with vertigo?
After we do an evaluation to figure out the cause of the symptoms, what we do for those conditions depends on which type it is. A common one goes by the letters BPPV. If you hear people talking about crystals in their ears, that's that type of vertigo. And for that type, we do a series of, basically we call maneuvers, a series of movements to guide those crystals somewhere where they're not going to trigger symptoms. For those where it's not BPPV, we teach patients in a series of combined eye and head exercises to either decrease their dizziness symptoms or with the end result of hoping to improve their balance.
Yeah. Well, it's good to know that physical therapy may be the answer for some folks out there. Now, if someone says, hey, I have some of these symptoms and they think they have vertigo, what should they do first, Jason?
First thing is, we want to make sure you're not having some other type of medical condition that requires more urgent attention. If you're getting dizzy without any provoking movement, so even just at rest, if it's after you've sustained a head injury, or if you have any sudden changes in vision or sudden onset of weakness, particularly on one side of the body, those will require more emergent attention. Otherwise, see your doctor so they can look you over, do a more thorough evaluation, and confirm whether it's truly a vertigo case or something that we would address.
Sure. Now, we want to get our viewers to you. So once diagnosed, how can someone connect with your services there, Jason?
First step, you have to get a referral from your physician.
Okay.
And then afterwards, you have to go for any insurance hoops that you meant to jump through. If you have to get like a referral, a prior authorization, any of those things that are specific to some insurances. And then once those are set in place, sometimes the doctor's office could call in to one of our offices to set up that initial evaluation. Or we also have a central scheduling number where people can call in to get scheduled as well.
That sounds good. So help is available. We love to hear that. Anything else that you'd like people to know, Jason?
Yes. Any of our outpatient locations have someone who can provide these services. And when you come in with a prescription that says for either what we call vestibular therapy, which would be the treatment for vertigo, or if that diagnosis on that prescription says vertigo or dizziness, you're going to get routed to a therapist who has been trained to treat vertigo and those types of dizziness disorders.
That's great. Well, thank you so much for this valuable information, Jason. We appreciate you calling in today.
Oh, thank you.
Of course, you're welcome. And for more information about today's topic, just head on over to the Hotlink section at WNEM.com.